Good afternoon. Thank you so much for participating in today's webinar. This webinar is the fourth in the 2016 Winter Webinar Series, 21st Century Student-Centered School Nursing. Today the topic is School Nurses and Motivational Interviewing, painting a picture of what school nurses can do. The panelists today are Sharon Guthrie, Mount Mercy University, MSN Program Director and Assistant Professor and Executive Director of the Iowa School Nurse Organization, and Rebecca Sidneski, Instructor in the Bachelor's of Science in Nursing Program, University of San Francisco, Psychiatric Nurse Practitioner at Door Urgent Care Center, Psychiatric Crisis Clinic, and part of Peninsula Hospital's Nurse Consult Team. Thank you, Sharon and Rebecca. We have a great conversation ahead, so let's get started.
Hi, this is Sharon Guthrie, and it's my pleasure to be invited as a panelist on this presentation for motivational interviewing. First, we want to review the objectives of which we'll be discussing, and those include identifying the differences between pathogenic and the health paradigms and differences in communication methods that can influence individual health behaviors. We will define and describe motivational interviewing in a few different terms. I think it's often something you're doing parts of the motivational interviewing already, but we'll define it more clearly. Identify situational elements that you might want to consider before initiating motivational interviewing. Identify the steps in motivational interviewing process, and then apply the process to the motivational interviewing with students, groups, faculty, staff, or parent, student, and dyads. So to start off, we'll talk about the differences between the health paradigm and the pathogenic paradigm. The pathogenic paradigm defines health as an absence of disease and focuses on what's not working within a system and then tries to fix it. So often this is when a healthcare provider will identify a problem and say, you need to eat less of a certain food, or just try to fix the health concern by just directly telling someone what to do. On the other hand, the health paradigm defines health as a fluid and more flexible process and takes into consideration all of the environment and personal behaviors into how health is shaped. The second difference we want to point out is that there's a difference in how we communicate with people. Again, direct communication is often authoritarian-like, could be coercive or persuasive and confrontational, confronting a client or a patient or a student and saying, you said you were going to do this, but you did something else instead. Or also using external contingencies, such as you want to make sure you graduate from high school, right? So why would you do this? You know, like kind of those kind of external contingencies that would try to influence or change people's behaviors. On the other hand, motivational interviewing is a communication method that identifies and utilizes an individual or like a student's intrinsic values and goals in order to change their behaviors. So it's very student or individual focused. And that, because the student takes more or the individual takes more ownership in it, it becomes more effective. The research shows that, this is from 2001, but repeatedly different research has shown that communication with healthcare providers is not always as open as one might hope. The non-effective direct communication often leads to barriers, and then that individuals, whether it's a student or an adult, doesn't want to change their behavior because they felt like they were not listened to. Most clients can identify 3 to 4 issues that they want to discuss with their healthcare provider before they even go in to see a healthcare provider, but they may not get to talk about all of those because they feel closed down in the discussion. The average healthcare provider will interrupt someone within 18 seconds often, and we know that 30 to 60% of medical information that gets discussed in a visit is often forgotten, and 50% of the treatment regimens are not even followed to their fullest extent. So this alone indicates that whether it's physician or whether it's nurse, but that we need to be really in tune with how we are communicating with patients and allowing them to be owners in their own health care and their own changes in their health behaviors. So before you start doing motivational interviewing, and I've taught about motivational interviewing for a number of years, and the more I teach about it, the more I understand it. So I think reviewing this is often very helpful. But before you start trying to implement using motivational interviewing, there's a few things I would consider. That is the amount of time that you'll have available to interact with an individual. It's not a long, lengthy process, but you certainly, it will be more effective if you have less interruptions. Again, considering your frequency of interruptions, you may have a student who the situation presents in the morning, but you know your afternoon is a quieter time in your office. You may want to have them come back at that time. Know what your resources are within your school, like what other support services you have, what the family resources may have at their disposal, and also within your community. In the end of the presentation, we'll talk about different tools that you could use for motivational interviewing, and then consider how often can you check in with a student on their progress. If you make an agreement that you're going to check in frequently, and then you're not back in a building for a number of days, or that could not lead to being as effective. So what is motivational interviewing? It's a person-centered collaborative counseling or communication style related to changing someone's behavior or addressing problems or ambivalence about change. It was first used most with patients who have substance abuse problems and issues, and so by using this method of communication, the research showed that the users were more likely to change their behavior. Another thing that motivational interviewing does is it examines and works towards resolution of ambivalence and to help the client then change their behavior. So it's really helping the client see their own ambivalence, and then by seeing that, recognizing it, and getting them to change their behavior. And we also work at evoking the client's motivation or commitment to change through an assessment of readiness. So while we can have these conversations, if a client is actually not ready to change, then they're less likely to go ahead and do the change. So a key point of motivational interviewing is doing this assessment of readiness to change. Focus and goal-directed method. Usually we focus only on one type of behavior at a time. So if you have a student who would come in and have a couple of different concerns or behaviors they want to change, the most effective way is to focus on one behavior at a time and work on that one, show success, and then use the same strategy to communicate and work on a different behavior. It's often used during single sessions or also in multiple sessions or communication exchanges. There is some research that would show even one single episode of using motivational interviewing as a communication strategy can make an effect on behavior change, but certainly if you can use it repeatedly, that would be more helpful. And it's client-centered, again, because the provider attempts to understand where a client is coming from. It's almost like putting yourself in their shoes, understanding their concerns about changing their behavior, and then helping them overcome those concerns. There's research that shows using motivational interviewing with adolescents is effective, particularly with health-promoting behaviors such as their physical activity, weight, nutrition, and/or sleep. And again, we already I mentioned that there is research that would show that there is this is a positive strategy to use with substance abuse. There's also some research that would show you can use motivational interviewing with a parent and child dyad. While as a school nurse, you may be discussing with the students themselves, but there may be a time in which you bring a parent in also to have this kind of a discussion. Again, the research showed that it was particularly supportive when you're focused on those health-promoting behaviors, reducing screen time, smoking cessation, or oral health and physical activity, but less evidence showing that the weight-related outcomes are as effective, like waist circumference or proportional body fat, when you're using the motivational interviewing. So the primary principles of motivational interviewing are to express empathy, that you want to see the situation through a client's perspective. And it goes, I think one key thing is maybe not to say, I know exactly how you feel, because we may not know how someone else feels. That's kind of impossible to actually know how somebody feels, but to at least see the situation through their perspective. We want to make sure that we support self-efficacy, that we focus on their personal strengths and previous successes. Try to, while the client may bring up times in which they haven't been as successful, always come back to the focus on their personal strengths and previous successes. You want to roll, in the literature about principles of motivational interviewing, we talk about roll with the resistance. And that when a client would come up with some statement in terms of why they can't make a change, or that they become negative, that they weren't as successful, you try to steer clear of those, the negative and the resistance, and again, bring it back with supporting their self-efficacy. And the last one is develop discrepancy or help a client examine their current situation in comparison to their goals or values. So, and later we'll discuss how some examples of how to overcome that ambivalence that you may hear from a client. So when you start out by the process of motivational interviewing, you first want to engage the client, whether it's a student or an individual, a parent, child, dyad. And by engaging them, often they suggest to ask permission. I'd like to talk to you about the situation would be one way to start that conversation. Or what, asking what brings them in today. Can we talk about a certain concern, and that would help change their health behavior. So engaging them by asking permission instead of being authoritarian. Second, you want to motivate the client or the student. And by motivating them, asking them what's important to them, identifying their values and goals, and helping them, keeping those primary values and goals in mind as you work towards how they set out a plan to change their behavior. And the last step is to plan and assist the student in developing a realistic plan. And I noted here as a SMART goal so that it becomes easier for them to follow. And for some of you, you may already use SMART goals. I tell students that there are no real dumb goals, but if you put them in the SMART format, that it often helps you to be more successful and to be measurable. So SMART meaning specific, that they're measurable, they're attainable, realistic, and time sensitive. So an example that I've listed below here is I will walk around my neighborhood for 30 minutes, 5 days per week during the month of April. So if you look back at the specific, measurable, attainable, realistic, and time sensitive, it's specific. It says that I'm going to walk and I'm going to be in my neighborhood and the amount of time, so it's measurable, 30 minutes for 5 days per week, and it's during the month of April. So it's very specific, it's very measurable. In terms of attainable, if I lived in a neighborhood that wasn't safe, or if a student did, then that's not realistic or attainable because I wouldn't send them out to be walking in that neighborhood if it was not safe. And then time sensitive means when there's an ending period to when they work on their goal. So an example, the example listed there on the slide is very much in the shape of a SMART goal. An example of a not as SMART goal would be I will walk so that I lose weight during the month of April. So it's not, there's not as much measurable elements to that. So kind of to summarize how you use motivational interviewing, and it is when the provider seeks to understand the person's frame of reference, particularly using reflective listening, and that we express acceptance and affirmation. And the affirmation is not given as much as just the general, generic kind of cheerleading-like, but really honing in on some of the positive statements or reaffirming with a client how they've made changes and been successful. It elicits and selectively reinforces the client's own self-motivational statements. So you really you have to be tuned into listening while you're using motivational interviewing, because you want to pick up on some of those key phrases and bring them back around in your conversation with the client. And we monitor the client's degree of readiness to change so that resistance isn't met by jumping ahead of the client. I think often we as a healthcare provider may see exactly what could be done, but if we don't have the readiness of the client, the success in changing behavior is less likely. And then lastly, we affirm the client's freedom of choice and self-direction. So often things come across very authoritarian, but we really want to encourage people to take their own ownership in their health and health promotion behavior. What motivational interviewing is not, it is not when we argue with a person that they have a problem or point it out and suggest that they need to change. Motivational interviewing is not offering direct advice or prescribing solutions without the person's permission or without actively encouraging them to make their own choices. I think you can often see the dichotomy between these two examples of when we are very direct, or someone may be very direct with a student and telling them exactly what they need to do. The motivational interviewing is not using authoritarian expert stance and leaving them in a passive role. We want to engage the client, the student, the individual into a very active role and taking responsibility in their own health. And when you're doing motivational interviewing, you will not do most of the communication. So motivational interviewing is not when I do most of the talking or the healthcare provider does most of the talking. Instead, it's going to be trying to elicit conversation out of the student, and then also not imposing a diagnostic label and not behaving in a punitive or coercive manner. So with that summary, I'm going to turn it over to Rebecca, who's going to kind of talk through the process of motivational interviewing and applying it to practice, and then we'll take questions at the end. Rebecca?
All right, thank you, Sharon. So motivational interviewing is going to happen in two distinct phases. Phase one is really about resolving that ambivalence towards change. And the best way we know how to do that is to really develop some gaps between their current behavior and then a desired behavior or outcome that that student or patient may have. So that might look like a statement saying, on one hand, I hear you say that you like ditching school to hang out with your friends, but on the other hand, I'm hearing you say that you want to go to college and become a nurse, an engineer, whatever it might be. So by showing those two dichotomous actions or events, we're able to show them that by using their current behavior, by continuing on the path, they're really missing out on that desired outcome that they're looking for. And phase two is going to be to utilize the ORS skills. So the ORS skills are utilizing open-ended questions, affirmations, using reflective listening, and then summarizing the interaction. And as nurses, we really are taught to affirm our patients and be very patient-centered. We're also very trained in using open-ended questions during our assessments to get the most robust data from our patients or our students. So we really are doing some of these skills. It's just about tying them all together and really integrating those into our personal process. So open-ended questions are going to be used to invite the client to really elaborate or think about their health behaviors, positive or negative. Affirmations are really going to help us build rapport and identify strengths with our clients. This is really going to help break down that expert, non-expert role or that hierarchy that sometimes we see when we're doing health teaching or health promotion. Reflective listening, so this is going to allow us to express our empathy and really help guide the patient or the client towards change. And then summarizing the interaction is going to tie it all together and really capture what our points of interaction were and also provide some direction for our next steps with that client. That might be the next time we meet with them. That might be the goals that they've set to do prior to our next meeting. So that's really just going to be a nice way to end the interaction with our clients. So some examples of open-ended questions. So you can ask something very simple like, what brought you here today? What's happened since we last met? What's happened? What happens when you behave that way? Tell me more about when this first began. But they're going to be very open-ended questions that we can get a lot of really robust data from, and that's going to help us be able to more affirm this patient or client because we have a better idea of what their strengths are, what their worries are in coming into the office. So the open-ended questions are really what sets the stage for the other steps in motivational interviewing. So our affirmations, so this is going to be where we really need to take whatever they said from our open-ended question and use it to have some positive interaction. And these can be very simple statements, like it's clear that you're really trying to change your eating habits. It's clear that you've really thought a lot about your risky sexual behavior. The way that you handled this situation showed that you have a lot of strength. So they're not prescriptive in any way. So our reflective listening, so these are going to be statements that start with, it sounds like, or I get the sense, what I hear you saying. So this is our opportunity to reach back into the client and make sure that we're getting what they're trying to tell us so that we can make sure that moving forward, when we establish those SMART goals and we summarize the interaction, that we really are capturing what it is that they're saying. So an example would be, it sounds like recently you've become really concerned about your drinking, or it sounds like you're ditching school is one way for you to feel like you have good friends because that's your time with your friends. I get the sense that you're wanting to change your behavior, but you have some concerns about what that's going to do to your academic performance. So reflective listening is really, again, very much focused on the information you received through your open-ended questions. And then lastly, you're going to summarize, and that's going to usually end the encounter. So an example would be, over the last 3 months, you've been talking about stopping crack, and it seems that you just recently started to recognize that the pros or the cons are outweighing the good things, and that your girlfriend is leaving you because you cannot stop using crack. So again, the spirit of motivational interviewing is really based on being very collaborative and non-confrontational. We want to build rapport and trust with our clients and students, and those affirmations and those open-ended questions are really what's going to assist in getting that therapeutic alliance. And that can happen in even one interaction, especially if it's a very positive one. So again, we want to evoke or draw out their own values and goals. We don't want to be authoritarian and really impose our personal beliefs or expectations onto them. So this really allows, especially adolescents, to form a better sense of their self and what's important to them outside of the role of their teachers or their peers or their family members. And then lastly, the spirit of motivational interviewing is very autonomous. We want to communicate in a way that empowers our clients. We want to give them the responsibility to make the change happen. We also want to allow them to really be the maker of success when change is made. So for identifying change talk, when we're sitting down to work with a client or interview a client, change talk is really going to come about when there's a desire to change or an intent to change. And this can happen in a variety of settings, whether it's an issue with truancy or substance abuse, anger management, any sort of risky behavior. You may have a student that comes in that wants to discuss their abilities to change or an optimism to change. We're looking at problem recognition or reasons to change. So this could be a family dynamic at home that isn't as stable as the patient would like. This could be a poor grade. It could be challenges with their peers. And then lastly, we're looking at a need for change or concern that if changes aren't made, there could be an outcome that is not desired by that student or patient. So in order to really sustain this change talk, we know that every client or student that comes in, we're not always going to be successful on that first try. So we want to make sure that we're keeping the door open and that we're able to sustain those conversations, because especially the first time someone is having a major change in their health behaviors, it can be very cumbersome, and it could be very scary. So we want to make sure that we can sustain those conversations as much as possible. So again, we want to roll with the resistance and really change our perspective to a more positive one and not go down the path of it does sound like that's going to be really challenging. Are you sure you can do it? Do you feel like you have enough support to do it? We want to steer away from those things and really come back to the positives about what's bringing them in and what is their motivation to change. We also want to reflect and respect the student's communication rather than reinforce their resistance or the negative aspects of their change talk. There are many skills that we can use for motivational interviewing that really provide a nice visual for the student. The first is a change ruler, and this will give us some really objective data in terms of how important it is for that person to change and how confident they are that they can make that change or that changes can be made. And there are various tools that are very similar, usually in a 0 to 10 scale, focusing on what is important and then how confident that person is. And then the other visual aid that we can use for motivational interviewing is a calendar. So when we were talking about those SMART goals, we said that that client was going to walk around the neighborhood for 30 minutes, 5 days a week for the month of April. So we could get a pen and paper, we could get a planner, whatever's at the disposal of you and the student, and then really have a visual representation of what the plan moving forward is. So they could write that in, they could color code it, whatever is going to work for them. But it is another tool to hold that person accountable while also really being very motivating. For the first week, they might only walk twice, so they might have 2 stars that week. The next week, they might walk 3 times. So it's a nice way for them to visually be able to track their progress and their successes. So application for motivational interviewing in school nursing. So motivational interviewing is a relatively low intensity intervention, but it has the potential to make a very high impact across many health behaviors. We know that we can use it with individuals to identify strengths and define changes in their behavior for improved health and academic outcomes. We can use it in high-risk groups to help support change, to help improve their health outcomes and their academic outcomes. It's possible to use motivational interviewing for student and adult dyads to really help change the behavior that can improve a family dynamic as a whole. And then we can also use it for faculty and staff to identify changes that need to happen at a professional level that's going to help improve the health of a school setting. All right, so some of the challenges which Sharon talked a little bit about. So we know that as nurses we are interrupted more times than we are not. So really having the time to sit down with a student and really give them our full attention can be somewhat challenging, but it's all about just finding that time, knowing when your office is a little bit slower and being able to carve out some time. We know that consistently using the motivational interviewing and the ORS format can be challenging at first, but I found in my own practice and in teaching others, school nurses especially, that motivational interviewing is very nurse-friendly, it's very patient-centered, so they find that it's pretty easy to integrate into their day once they get over the initial hump. We know that there's an increasingly short availability of school nurses to follow up with students and parents. Where I am in California, it's very rare that a school nurse is at one site. For the most part, they're at 3 to 4 sites. So having the ability to really follow up with their patients and their students is really challenging. We know that sometimes a student or a student parent dyad may not see the situation as a problem. So when we talk about readiness to change, that might not be there yet. So it's important to keep those lines of communication open in case they do have a change in their perception. We know oftentimes, especially with adolescents, that there may be a difference in perceptions between a student-parent dyad. So working with some of those aspects can be somewhat challenging for the school nurse. And then students and parents might find it difficult to make changes because of barriers to their finances, barriers to their safety in the community, barriers to transportation. There could be a whole host of challenges there. So there are some applications that you can use. Change Talk is one that's pretty significant, and this was developed as a partnership with the American Academy of Pediatrics and Cognito, and it is utilized by practitioners to to help bolster their skills in motivational interviewing. So you are actually put into simulation areas, and you get to decide how you want to respond to a mother and their child around issues with obesity and changing some of those health behaviors. So it's a free application. It can be downloaded onto an iPad or a smartphone, but it's really a great tool for anyone that wants to hone in those motivational interviewing skills. We know recently there have been a huge amount of publications about motivational interviewing in the last few years. The Journal of School Nursing has published 16 articles that are readily available about motivational interviewing in the school setting. And in the NASN journal, we know that there were 5 articles. 4 were most recently in the January 2016 edition that are related to motivational interviewing, and another in July of 2015. And these are our references. Our contact information is here. Sharon and I will be answering as many questions as we can now, but if something comes up, you are free to email either of us and we will get back to you as soon as we can.
Well, thank you, Sharon and Rebecca, for this informative discussion about school nurses and motivational interviewing, painting a picture of what school nurses can do. All attendees will receive an email with a link to the slide deck and recording. And one final note, of course, is that NASN's annual conference will be here before you know it. NASN 2016, Learning, Linking, Leading. So start planning now to attend NASN 2016 in Indianapolis, Indiana by setting aside time to attend. Visit nasn.org/NASN 2016 to access the attendance justification toolkit. This is Margaret Salucci, NASN's Director of Communications, and on behalf of NASN, thank you so much for joining us today.
Thank you, Rebecca and NASN, on behalf of highlighting this topic of motivational interviewing. This is Sharon, and I am not seeing any questions being posed in the question box, but go ahead and feel free to type any if you have some. We'll stay on just for a few minutes. I would reiterate some of the things that we talked or that we shared in our presentation. That in the slide about change talk, Rebecca highlighted like some of the concept of change talk, or what you want to listen for when a student says, I think I'm ready, might be one way, or a student saying, I recognize I need to change. That's change talk. And as a school nurse, need to pick up on that because that is and hone in on that because that is showing you a little bit of readiness. Another comment I would share was, I don't know how often school nurses will do this dyad conversation with parents. I know in my past experience as a school nurse, I had a couple of instances where I kind of served as a moderator between a parent and a child because they had differences of opinions, but yet it was focused around their health behaviors. And so I served as a moderator. I could see now using motivational interviewing would have been really helpful to also enhance that conversation and to learn what I could do to help set a plan for the family.
Well, thank you, Sharon and Rebecca, and everyone for joining us today.
Thank you.